this section, we're going to talk about elders who want to age in place, who want to remain in their homes, and what the different options are for home care in order to help them or to help a family caregiver out so that they can remain in the community longer. So first we'll talk about aging in place, meaning choosing to age in your own home. As we've said in other sections of this module, it is what most people prefer. And adaptations may be needed, renovations to the home, assistive devices. But when more help is needed than just simply renovating the home and getting them assistive devices so that they can use by themselves, then they need home care. It's the favored option over moving in with a kid or being placed in a nursing home. Again, I have to stress that once the person needs home care, caregiving is a 24/7 job, and no one person can be on call 24 hours a day, 7 days a week. Everyone needs help. So the options are family members sharing care. Family members are the main caregiver, but they have help from a home health aide. Or the opposite, home health aide is the main care with help from the family. Sometimes some families, a very common arrangement is to have a home health aide 5 days a week during the day. And then adult children, the spouse or adult children, or both, will take turns with evenings and the weekend. And some people need and are able to have full-time paid caregivers. In other words, 2 to 3 shifts a week, so that there's always someone with the elder who is a paid caregiver. So what are the types of paid caregivers? The most common is the home health aide, which is basically a nurse's aide, but who works in the home, and they're called a home health aide. They do mostly personal care, right? So they, and some light housekeeping services. So they'll bathe, dress, change diapers if necessary, feed if necessary, get medication, they do not prepare or count out the medications, but they can give the medications. And how do you find a home health aide? Well, you can go to a home care agency and have someone referred. You can independently hire a person. And some families hire a home health aide to live in the home. And basically they are working 24/7. They generally have a couple of days off a week where they go to their own home, but otherwise they sleep in the home and are woken up when the person needs care in the middle of the night. For someone who doesn't need personal care, you might just have someone in to do housekeeping services or deliver meals. And if more skilled care is needed, you can have a visiting nurse come to the house once or twice a week to check wounds or do infusions or more serious care. Once the person needs nursing care every day, then it's time, unfortunately, to move into a nursing facility. That's something that can't really be done at home. So if you're going to have a professional paid caregiver, how do you choose them? Well, you want to make sure they've had good training, right? That they know about elder care, they know about the particular problems that your elder is facing. You want to check references. Have they worked for other people? How did that go? Preferences of the elder. I mean, sometimes a person wants someone the same gender as them. They certainly want to be able to speak the same language. They might just have personalities that click or don't click. And you want to be able to have good communication with the family, right? The family and the caregiver are partners in caring for a frail elder. So you want to have good communication between this person and family. What are the challenges of finding paid caregivers? Well, financial, it's expensive. And if your insurance doesn't cover it or doesn't cover enough hours, it's very expensive to pay someone to come in out of pocket. There can be big cultural differences between the family and the person who is a caregiver. Unfortunately, sometimes the caregiver, paid caregiver, gets abusive remarks by an elder who's maybe demented and no longer realizes you're not supposed to say stuff like that. And that can be a very difficult situation. But sometimes there are just cultural differences in terms of understanding what the older person likes to eat, what they like to do, and that can be challenging. There can be stigma, especially in some ethnic groups, of hiring a paid caregiver rather than doing the work yourself. And there's worry about reliability. Will the aide show up? Will I be able to get to work?